Hi everybody, welcome to another edition of Hazelmere Community Rugby Club's Wellbeing and Mental Health Programme. Today we're going to be taking the opportunity to have a chat with a facilities expert around reopening clubhouses and what we're going to need to do for things like changing rooms and stuff like that to make sure we look after the wellbeing of our players and the staff that are working there. So I'm joined today by Adam Mason. He's going to do himself a little introduction in a second. One thing to bear in mind though is obviously this isn't an official interpretation of rules. This is our interpretation of the guidance that's been given. But Adam has many years experience in the facilities and building industry, so he will know the rights and wrongs. Again, we're sponsored by Mindset, the mental health and wellbeing consultancy, who deal with hospitality and retail trade, and they also help out little local sports clubs with their wellbeing programs. So I'm going to introduce Adam and let him talk about himself for a little bit, and then we'll get onto the questions. Ad?
Good morning. So I'm a facilities manager by trade. So I've worked at companies like Pure Gym, Kingfisher, B&Q, etc., and headed up their facilities function. And also currently doing Let's Talk FM, which is offering the FM and property community advice around the current issue of COVID-19, but also on wider FM issues that are going to come from this, because it's this is a one-time thing, hopefully. But some of the best practices we can learn from this could be taken on to provide a much better environment for people working. And I think one of the things I would say about the advice today is there's a big disparity about what large businesses can afford to do and what small local sports facilities can offer. It doesn't need to be expensive to be safe. If you follow the right guidelines and implement the right things and use a bit of initiative, I guess would be the word, you can add all of the really expensive things for much less of the cost and just tweak it slightly. And that's what I will be focusing on today, taking something that possibly a large Witherspoons can introduce as an example, and how do you get the same kind of impact and safety by doing something a bit more cost effective, as I would say, and introduce that safety, because that's the biggest thing. Clubhouses are a revenue stream normally for the local sports facilities, and that's what I think we need to get back open as soon as we can.
Yeah. So straight into it, I guess. The clubhouses would have been closed since February, March. They should have been mothballed, but I'm imagining people will be going in and out. So what sort of cleaning regime is going to be needed? Because obviously nothing should have been touched for the last 4 months. So really there should have been no transmission, but there may well have been people in and out. And I'm assuming there'll be a big group of volunteers all ready and willing to go in and help and clean, and which in itself could cause a problem. So what sort of things do we need to be making sure are done, cleaned, double cleaned, but also to make that sure that that environment is safe for the people in there cleaning, as well as the guys coming in afterwards?
Well, first, the deep clean is not to get rid of any viruses. Okay, so the deep clean is around creating a manageable place moving forward. So removing all of the dust and the contaminants, not viruses, contaminants that will be there, that it has been proven that viruses can latch onto much quicker and easier and stay alive more. So let's put it this way: in a dirty environment, and somebody comes in with an infection, it has got more chance, supposedly, of staying within that environment. So the best thing to do with the deep clean is to really break down the dust, the grease, the grime, etc., and get back to a nice, clean surface. Disinfecting it, absolutely. Realistically, a good solid clean with good products that are well known onto the marketplace, that are proven to kill viruses. Be careful not to choose stuff that could do bacteria. They're very two different things.
Yeah.
So virus cleaning will give you a brilliant start. The people that are coming in to do it, one, I would put people into sections. Two, I would expect them to be wearing PPE and gloves and masks, etc., and try to keep them, obviously, the 2 meters apart. And we'll go more into the 2 meters rule. But, you know, I would, if you've got an army of people to help, brilliant. I would break them into sections of the building. I would obviously plan that meticulously and let them crack on with good home cleaning products that are registered to kill envelope viruses, which is what corona is. So there's a BSEN, I can't remember the full numbers, but if you look at a BSEN for cleaning products, there is one there for specifically for this. Now, it's not proven to do anything with COVID yet, but the chances are it's going to be more successful than anything else from a cleaning product point of view.
Even something as simple as soap and water, because soap and water talks about a lot about, because it breaks down the membrane of the virus or whatever. I'm no expert, but if is soap and water a simple washing up liquid in a bowl of water? Is that going to be good enough?
No, not on contaminated surfaces. So the thing with soap and water is that it breaks it down, absolutely it does, and then you put your hands under the tap and it washes away the virus and it weakens it all. So for the 20 seconds it's there. You can't get the same action unless you've got a hose pipe and you're scrubbing everything down and you're flooding the place. And then that water's on the floor, and that water's got to disappear down into the drains and everything else. So I'm not an expert on this, but basically the cleaning product has little spikes in its molecules which basically pierce the envelope of the virus and then kills the virus inside. So when you're doing the cleaning of the surfaces and everything else, that's kind of how it interacts. And as far as I'm aware, and then it breaks it down, and then obviously you end up very quickly with a virus-free area. The one thing to say is that none of these products have been tested on COVID-19. It is likely that the BSEN standard products will be able to do it because they've been tested against envelope viruses. So again, it's just using good quality cleaning products as per the manufacturer's guidance, which is, before you put them on, you clean the surfaces down, get rid of all the dust, get rid of all the contamination, get rid of all the grease. You then apply the disinfectant as such, and then your building is clean. You don't fall into the trap of just getting this product out, spraying it and wiping it down, because that doesn't work. Because once it's embedded with dust particles and everything else, it can, again, supposedly it can stay for longer, and also it's harder for these products to break that down. So they need to be on really clean surfaces. And there's products out there that will last 6 months and have been proven to last 6 months, not against this virus, to say that again, but against other envelope viruses, where you could buy some and it be used on some of the key touch points. So some of the doors. This doesn't stop you having to clean. It doesn't stop you to having to disinfect. What I would say is there are products out there that may be able to support the longevity in high touched areas. Again, no one can prove that at the moment, but it might offer you another layer of protection without too much expense.
So all of this stuff, the deep clean is great, but obviously you're going to need to set up a regimented cleaning schedule, because after this, so before matches and after people have been there, so there's going to need to be some sort of schedule of cleaning afterwards, because I'm guessing you've been in many club sports houses, and I've been in many changing rooms, and they're not exactly the most salubrious of places. They are basically 4 walls made of breeze block, occasionally with a coat of paint on it and a wooden bench, and then probably 6 months worth of mud. So that can't I'm assuming that's not going to be able to happen going forwards until this is all done and dusted. We're going to need to have clean.
Yeah, I mean, there's lots of things you can do to try and stop the spread into the building that necessarily aren't expensive, but cleaning regime of toilets, of high touch areas, transition areas, and dwell places is key. So, as I say, if we talk about tables for a minute, yeah, family goes down. It's a nice clean table, so it's been wiped, it's been disinfected, it's ready. You do basically the table, the seats, right? The family
As
come
you'd
in.
hope, as you'd hope a decent restaurant or anybody else would do before you went and sat down.
Absolutely, but you've just got to be. Again, I don't think this is increasing necessarily a lot of people's perception of what they do. It's just making sure that the people that are doing it understand how to do it properly. So most companies will probably have some of these products sitting on their shelves and are used on a regular basis. But it's just, are they being used properly? And are the people taking the time and the care and the attention to do it? That's so, again, wiping down the right areas of the table, ready for the next person to come in. Now, I would say transition time from cleaning the table to the next people sitting down. With these products, you've got to give yourselves about 5 minutes. Yeah, I think that is a sensible leeway of time that from one transition to the next transition. You can't have immediate transitions anymore. That's my personal opinion. So that's what I would, if I was looking at something that was effective, getting it cleaned, getting the product onto the table, giving it a little bit of time to work. Normally works within 1 to 2 minutes. Giving yourselves 5 minutes transition. Hey, that's you're pretty much going to be safe.
Cool. So we've got clean, everything's tidied, we've got a cleaning schedule in place. How do we manage the communal areas then? We'll come on to the bar area and that sort of after game communal area in a bit, but changing rooms don't tend to be big enough to cope with the number of players that normally go into a changing room anyway. So now we're looking at trying to create more space for people. We've got showers, we've got this. Obviously, this is all assuming we can go back to playing contact sports.
Yeah.
But this is even going to apply to things like leisure clubs where you're allowed to play badminton, tennis, possibly even squash very soon. Those sorts of things. Those communal areas that we've got. How do we manage those in a way that is safe for staff and customers?
Well, I think there's two things to this. The absolute safest way is everyone to turn up ready to play the match. Yeah, so they take responsibility for their kit. They take it home, they wash it, they wear it, and then they go back to the back of their car, they get changed, and they come in to maybe the clubhouse. Let's be honest, that is the safest way. The more that you mingle, the closer you become, the more risk is there. That's just plain fact. So the first things first, can you stay apart? So 2 meters. Forget the advice for 1 meter for the moment, because that's 1 meter plus, and the plus means some other form of control. Okay, that's not suddenly everyone can go down to 1 meters. Yep. So let's look at 2 meters to start with. Can you set out spaces for 2 meters, and can you stagger people coming in to get changed? So in other words, you've measured your changing room. You can fit 6 people in it. Yeah, they can all socially distance, and they're coming in groups. So again, one in, out, and it's all controlled by a coach or a manager, that entrance and exit, because that's going to be the easiest way to do it. So get 6 people in, get them changed, get them out in the field. Get 6 people in, get them changed, get them out in the field. Yeah. Let's be perfectly honest. Through that, we're not too worried about that and turnover of cleaning and everything else. But I think you've got to be very wary of touch points and other bits and pieces. But maybe disposable gloves, as an example, are available at the door for when you're into the change room getting changed. So really simple like that. But you know, I'm not too worried about those kind of controls at this point.
To coin a phrase from Boris Johnson, people are going to have to use their common sense. If they're feeling unwell, they shouldn't turn up for a game. You know, if they've got a temperature, they shouldn't turn up to play. You know, those sorts of things. So
Yeah,
we are hoping people will apply their common sense procedures before they turn up as well, aren't we? Before we go into it.
absolutely. I mean, I think one thing, if you're feeling that rough, you're probably not going to be coming to play rugby or football or cricket, as an example. It's just not going to happen. But it's this is all of these measures are really going to be targeted at the asymptomatic people, the people that just don't have any symptoms, that don't know that they're ill, and certainly that's the biggest concern. You know, anybody going out with a temperature at the moment needs to think hard about what they're doing, and this is why the track and trace is so important. But on this point, you're not looking for people with symptoms. You're looking at how to control the unfortunate person that doesn't know that they've got it, coming into an environment and thinking they're absolutely fine, and not adhering to some of the controls that are in place, and accidentally starting a hotspot. That's the point to it.
So
and that's where I would control it. I would look at how many people you could get in. I would get those changing groups, get them out onto the field, all team meetings, all team talks outside, big circle, keeping a distance, outside the better. They're the entrances. Now coming back in is really interesting. I think if you're able to control the people coming out, you can also control the people coming back in. So again, it can be 6 people in, 6 people then go into the showers. You're saying 2 meters apart. As an example, within the shower area, you can have your shower nice and safely. You then come out. I mean, this is all about control and time.
Yeah.
If people want to rush, then go home in your kit. That's the best thing for you. Go and get you showered in your own house, and do what you need to do away from the clubhouse. If you're looking to join in that whole social circle, just expect all of these transitions to take a little bit longer, because you're putting the controls in place just to keep everybody safe.
So that'll be an interesting conversation with somebody in the middle of January when it's raining and you're coming off the pitch covered in mud. No, you're in group 6. You have to wait outside for 30 minutes until you can go in. I think, that'll be but then I suppose people will have the choice, won't they? They can then decide to go home, can't they?
Well, first off, I believe in all of this is down to choice. You've got the choice of whether you want to go back and play contact sport. You've got the choice whether you then want to interact and use the facilities in a controlled and safe manner, or go home and get showered and get changed, or stand outside at the outside tap and put the hose over you and jump in the car. There's so many. What we've got to, all of this is we've just been talking about it with the gyms and everything else, and the fact that they're not able to open, and there's lots of different thoughts about that. But again, this comes down to personal choice, whether you want to go and exercise in that environment or not. You just need to understand the risk of what you're doing, and the choices you're making, and the increased risk of in this case, like a contact sport as an example, and one where you are going to get muddy. Now, cricket in the summer is a very different thing for their clubhouse, because they're probably not have to shower due to being covered in mud and dirt and everything else, and also they're not a close pitched contact sport.
But they're going to have different problems, because obviously they've got 11 players sat there waiting to come out if they're batting. They will have all of those different setups. So the best bet is a hot and cold mixer tap outside and a Karcher pressure washer, just everybody before they come in and out. Is that what we say?
Pretty much. Yeah. I think, let's be perfectly honest. I've said it a number of times to people. This doesn't need to be expensive. This needs to be controlled.
Yeah.
This needs to be monitored, and this needs to be reviewed constantly. These are about making the right choices at the right times with the right controls in place, which, yes, will most undoubtedly slow things down, but will make things possible.
Yeah.
That's the difference. You've got the choice to either wait and do it properly or not do it, basically. And that's the philosophy I think the local clubhouses have to adopt.
Yeah, because we're not going to have the access to like the Premier League and blood tests that come back in 7 minutes or 7 hours, whatever one it was, I can't remember, temperature checking and all that sort of stuff. So yeah, you're just going to have to make that choice of, if I want to play, I'm going to have to follow these procedures.
So things like the controlling when the away team turn up, how they are going to get changed. They need to be separate, not really coming into the same corridors as you. So it might be even be thinking around how you use your changing rooms, because you might have a fire exit to one changing room, and I'm just making this up, maybe not to another, it's the only entrance. And how can you separate the two teams? What controls are you informing the away team must take before they enter your building? So very short document. Again, you have 6 at a time that can get changed. You must wash your hands as you come in. There is soap, there is antibacterial gel, blah, 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 by your front door. So, all those little pieces you can do for them first stops that on-site, I guess, ambiguity of what's happening. So their controls need to be the same as yours. Your players should be coming through the front door. They should be cleaning their hands with antibacterial soaps and gels, etc., etc. It might well be really, really simply, if the away team have to move through the location to use toilets, as an example, you might stipulate that when they're on the move outside their changing rooms, they've got to wear masks. Because again, that's just a movement around. You don't want to the kind of foreign droplets, I guess, from a team outside coming into a communal area that you're trying to keep control of. So wearing masks would be a great example of a control that you could do quite simply for them. And most of them people would have bought their own masks now anyway, due to public transport and just the guidance, I guess. So there's a couple of things there that I think are really important, but I would get it all written down. I'd get it out to everybody. Everyone understands what you're expecting and when you're expecting it.
So do you think on that point that keeping records of players playing in certain matches is needed for the sort of an in-house track and trace, for example, so that if one of your players comes down and that player is responsible to then inform the club and say, look, I've come down with COVID. These are the last 3 games I've played, because we're not going to be able to, they may well introduce a 14-day break in between games, but I can't see them doing it. So you can sort of self-isolate, but that's probably not going to happen. So do you think we should have a register of who played? And I know that's quite difficult, especially amateur, where you've got one bloke signed on and then you borrow someone from another club and they play under that person's name. And there's all of that sort of stuff that goes on. We all appreciate that. But somewhere a private list of who played so that we can do a track and trace.
Well, obviously, I hope none of you are breaking the rules of players signed on, because that'd be terrible. But yes, you should keep a register of everybody that visits the facility every single day, whether that be players, whether that be staff, whether that be visitors and guests.
Training as well?
Pardon?
Training as well?
Yeah, absolutely. I think one of the key things is being able to communicate an issue quickly and effectively. And when you are mixing a number of people together from outside, understanding who's been there, and giving them all guidance that they need to inform the club if they come down with symptoms, whether they've come to use your clubhouse for a single beer or whether they've come to play rugby. I think everybody has a responsibility of we're not asking you to because you've got Data Protection Acts and everything else that you've got to look into. You don't need their full address and all their details. You know, can I have your name and telephone number, please? What we're going to do, we're going to store this in our safe for 14 days. We've marked what we've put in there. After 14 days, we need to destroy this piece of paper. You know, because actually, if no one's told us in that period of time, kind of thing, it's So I would follow. Most clubs will probably have some level of data protection.
They will have for
process anyway. So they just need to follow that with this extra personal information from people.
And I guess that comes for visitors if you are lucky enough to have a supporting crowd, which is probably slightly more difficult to monitor because obviously people can just turn up and watch in an open field. But
yeah, and I think just people standing 2 meters away from everybody in an open field is by the by. To be perfectly honest, you don't really need to
only if they interact with the facilities.
Yeah, if they interact with the facilities, you obviously need to take their details, and I guess so that's using the toilets as an example, which need to be really regularly cleaned, and I think also for clubs that have people that sort of come through the clubhouse to go to the pitches and stuff, it's even more important because even some local rugby clubs and football clubs have sort of entrance and exits through a single passageway. So, you know, whether they're charging or not, I still think it's really important. Just enables you to be aware of everybody's safety rather than just the sort of the players, if that makes sense.
Yeah. So we've kind of done starting, pre-start, starting a game, throughout a game. So there, I suppose we should move into the social side afterwards. The clubhouse itself, the bar area, the toilets, the public facilities. Obviously the new guidance has been released around what pubs can and can't do. Table service indoors, free for all outside, as long as everybody adheres to the social distancing. But you know, and we've seen a lot of public toilets open and coming up. So, what guidance can you give people whose facilities are not, you know, they're not, as you said, they're not a Wetherspoons, they're not a full-on pub. That, you know, they may have a bar in the corner upstairs somewhere that is very small, isn't exactly salubrious, and doesn't allow them to put table service and all that sort of stuff into place.
Yeah, it's interesting, isn't it? So, I mean, this comes down to the cost of people in some respects. So if you're currently, the pubs are going to have more people to do table service than they could do with just having people at the bar, as an example. The pubs are going to become more like restaurants, you know, and restaurants have a lot more staff than your local pub to serve the same amount of people. So that the cost of that service is going to go up. Then you've got how do you in a location suddenly have table service? Is it just that someone's going to walk around and go, do you need anything? Do you need anything? Do you need anything? Well, that doesn't feel great either, because you're supposed to limit the contact from your staff to the guests. So then do you install some sort of table call service, like in an old snooker club? You flick on the button and the staff look out for it and it comes over. And then so you've got all of these kind of different ways of introducing this. And I did have a little bit of thought. So if you're lucky enough as a clubhouse to have some form of internal space where you can set up for 2 meters, you can put up all the signs that you need, you can have your wash facilities coming in and out. You might ask people as they enter, not as they're sitting down, but as they enter or they move around, to wear face masks, where they might come less than those 2 meters around. So if I'm going to the toilet, we'd ask you to wear a face mask. If you're walking to your table and you're entering the premises, we'd like you to wear your face mask. But actually sitting down, it doesn't matter, because
when you're in your 2 meter square or whatever it is, whatever we are, you can do what you like, touch who you like within the guidelines that
single family,
but if you're in that group, that's fine, or whatever the guidelines are when we are allowed to open. But if you go into communal spaces, such as where you may come into contact with others, you are putting on PPE, face masks.
Yeah, I'm not so total around the hands at this point, because you've done the disinfecting in and out. Staff should be doing their washing their hands every 20 minutes. My big thing about masks is the spread of the contamination, that the individual that doesn't know that they have coughs, and that will travel as they're moving around the location. That there's absolutely no reason to wear them in your social bubble. But if I'm just thinking about this, you go into the toilet, the person's cleaning the toilet quite regularly, you go into the toilet, you cough, that then sits there. Yeah. If you're wearing a face mask, less is going to be there, less chance of contamination is going to be there, and the next person coming into that is. So it's using face masks for the right thing, basically. I think is the key to that. But anyway, so there's lots of things you can do. You know, I thought about the table service and how do you implement table service really, really cheaply, and thinking that most clubhouses are following the 2 metre rule, which is what they should do. If they have to go down to the metre, then they've got to have a much more robust risk assessment. But let's talk about 2 metres, because I don't think we should be talking about a metre. In all honesty, we're talking about 2 metres. Do you remember when you were at school? You had a little block of wood with a lamp on it.
Oh yeah.
Yeah, with a bulb on it. Literally, you could buy. Yeah, you could literally buy a couple of cheap lamps, plug them in, and okay, I want table service. Click, you know, and I guarantee you can get donation of lamps, and that means the staff know that table wants some more beers and everything else. I would also set silly little things up like, will you be changing your drinks today, or are you now going to carry on ordering the same drinks? Oh no, we'll always order the same drinks. We're not going to be considering ordering anything else. So, okay, is it okay if I see your light comes on, I will bring you back exactly what you ordered last time? Yes, I would. So in other words, there's very little interaction. I turn on my light, my beer comes over, I get my beer because that's what I'm going to be drinking today. You know, that kind of thing can also limit some interaction. The great thing about clubhouses in all of this is they have outside, and hopefully a bit of outside. And in the summer months, as we're coming into, I would always encourage that the dwellers are outside where possible, and that requires you obviously providing seating outside, and then once they're outside, I would also do some waitress service outside and that can be very simply hand up, I would like you to come, and because the transmission is going to be very different.
Do you know, and it's just crossed my mind, if covered outdoor areas, i.e. open-sided marquees, would be classed as indoors or outdoors?
I don't know. I would say anything that impacts the UV lighting from outside, you need to take bigger control over. So the way I look at it is if you've got a UV protected gazebo sat over a table and someone coughs onto that table, the virus, without the correct cleaning, is going to stay there for longer, because it's not getting the UV rays to break it down. Simple as that, basically. So any covering, I would think you should treat differently, to more inside than outside.
Okay, so if you had limited space indoors and you were thinking about setting up an additional area but making it covered so that it was less weather dependent, you would treat it as an indoor area and have your table service just to be on the safe side,
especially from a cleaning point of view. Yeah, you know, everybody knows that direct sunlight has an effect on envelope viruses, and it will last less outside. Again, there'll be different amounts of times it lasts on different types of services, even with UV. But this is the whole reason why outside is, there's 2 reasons why outside is classed as better. One, a mixture with fresh air. Yeah, you know, you've got to have, I'm not a virus expert, but inside, the virus is likely to stay within the air for a longer period of time. From my understanding, through the air conditioning, the recirculation of air, and other bits and pieces. Where outside, obviously, it's a much more, when you cough, it dissipates quicker, it's quicker to drop to the floor. This is why we've got the 2 meter rule, and etc, etc, etc. So I think the minute you start turning the outside inside, you've got to bring the inside regimes outside.
Yeah.
Try and keep the outside as much outside as possible, or adopt the inside regimes outside, which is never going to be a bad thing anyway. But you know, I've seen there's a restaurant, I think, in Amsterdam, that's built all of those like plastic igloos out by the river so everyone can go out. Now they're all completely see-through, but are they UV protected? If they are, they should be cleaning them as they're the same as cleaning inside.
Yeah. So what about things like glassware? Because obviously you're going to have, you're going to have people touching glasses. People are going to need to collect glasses. Do you bin it off? Do you just serve bottles? Do your staff go around with PPE on when they're collecting glasses? You know, or do we just go down a route of plastic, which is obviously creates another problem? Because obviously, you know, if every pub and club in the world is using plastic, then it's going to create a massive waste issue,
and it will get quite expensive.
Yeah,
I'm pretty sure. So there's two things. So staff should be washing their hands every 20 minutes. They absolutely should not be touching their face and mouth through
which
this
is
whole
basically hygiene regulations anyway.
Absolutely. So if they are washing their hands every 20 minutes and collecting glasses and not touching their mouth and face, from a hand contamination point of view, of having to wear gloves or not wear gloves, it's kind of there's nothing in it really. So I would probably suggest, if you can trust your team to do it properly, and they feel that that's the right thing for them, because this is about building trust for them as well, you say so. Because the one thing with gloves is, you know, they get contaminated as well. So you should be changing your gloves every 20 minutes in the same guidance. So yeah, and if you put your glove to your mouth or your eye and it's on your glove, there's exactly the same risk. So
it's from that point of view, you know, follow the standard food hygiene rules that are in place that to protect you and the customers already from other types of infection that may be going around, you know, common cold, flu, you know, all other things that you would should be doing anyway.
Yeah. So do I think, going on from there, that staff should wear masks because they're intermingling and moving around with lots of different people? I've probably got to say I would. I would want my staff that are walking around to be wearing a face covering. I think it protects, because they could be asymptomatic as well.
Yeah, exactly.
They not know.
Rather than.
Yeah, so I think I'd want them to do that. Yeah, I had thought about how can you protect a bar area, and you know, so if people are coming up to the bar, which I know is not quite allowed inside yet, but you could put some form of perspex screens in certain places, and then if you do have queues, you put the signs out that say this is where you're queuing. You're not allowed to have more than 2 or 3 people in a queue at any one time. Again, this is about control and management. I think it's kind of really sensible, isn't it? You've just got to keep washing your hands, protect the spread, clean, and if people are not going to be following the rules, you've got to be strong enough to control them, which is asking them to leave. And you've got to keep your staff on point that they're following the rules. And if they're not, deal with them. So I think all of this is about just control, realistically.
So not easy, but equally not overly complicated. It's doable, as long as you make sure that everybody is compliant. Because it only takes one person not to be compliant for it all to fall apart, I suppose.
Yeah, yes. I mean, we go back to that. Reopening doesn't need to cost money. It needs to be thoroughly thought through. It needs to follow the guidance. You need to risk assess it. You need to understand what controls you're going to put in place to manage those risks, whether that's social distancing, masks, signs, hand sanitizer, gel, etc., etc. You've got to test it, then review it, then get it live, test it, and keep it under review, and make sure that everybody is absolutely clear and bought into everything that you're doing.
Yeah.
And it's I hate to say it, but it's the side of management that people don't want to do, because it's very much going to be tell.
Yeah.
You know, this at this point, to control the safety, I think you need to collaborate with everybody that works with you to start with. Absolutely. Understand their concerns, their fears, build the plan around them, with them involved. And then it's, if you don't do this, then we're going to have to deal with something around it. And that is guests as well as staff and people that are interacting. You know, it's to keep costs down, as I say, control and time. You've got to build into all of this, and people behaviour, as we've seen, is terrible. So you've got to be brave enough to confront that and stop that behaviour before it gets too far. So if you've got too many people coming in, you've just got to stop it. You've just got to stop.
It would be interesting. What's going to be interesting for me is say, with the advice that you've offered, whether the FA, the RFU, and all this sort of stuff, whether amateur clubs take up those challenges. And if you're talking about risk assessments and away team arrivals and this, that, and the other, what would happen if I, as a coach from my local rugby team, turned around and said, I am not coming to play you this week because you have not sent me your risk assessments. I do not believe you've done this. I do not believe you've done that correctly. And I don't believe it's a safe environment for my players, which I would happily do. But it would be interesting to see if the clubs ever get sanctioned for that. Because, I would quite happily turn around and say, I'm not coming to your club. You haven't sent me a risk assessment. I don't know what the shower situation is. I don't know this. I don't know that. So I'm not coming. And I don't expect my players to.
So I think amateur leagues can get together. So every amateur league has a governing body, and has people that represent their amateur league. And I would be shocked if they haven't started discussions on how to restart, because we don't know when this is going to disappear, do we? Let's be perfectly honest. We've all got hopes and we've all got dreams, but we don't actually know when this is going to change. So I think, from my point of view, all of this needs to be in collaboration with every single club. There needs to be an agreed process across all clubhouses that are adapted to suit the individual environment, size, shape, and everything else locally. But the local leagues should be giving you some level of here is the big overarching guidance that comes from the professional game. These are the things that we can implement in a local sporting venue as such. And then the sporting venue taking that and going, this is how we're going to control it, and this is how we're going to do it, and kind of getting that approved from the governing body. And then there should be none of that happening. Yeah. So if people aren't doing that today, they need to be doing it, and need to be setting an example for others to follow. Because if and I've said this, right, so it's one big thing, and I'm not going to make a big song and dance about it, but in it reopening gyms, I've heard a whole load around cleaning. I've heard a whole load around management, spacing of equipment, everything else. I've heard them say, but we've got great ventilation. Well, okay, you tell me your air quality scores, right? I'm only going to come to that gym if I know that what you're telling me from a ventilation and air quality point of view is true. So I want to see your air quality scores, your airflow scores. I want to know that. And that means I know that I'm walking into a safe environment. You know, if I don't know that, I'm not going to step foot in a gym. Same as a rugby, same as an office. If I'm asked to go back to work, I want to see your risk assessments. I want to see your method statements. And secondly, I should already know what's going to be in them because you've consulted me. So actually, you know, I'm now just assessing them, putting them into my own job role and deciding whether it's safe for me to go to work, whether that's catching the train. So I then go, I'm not catching the train because I'm asthmatic. So I want to drive. Can you provide me a car parking space? Yes, we can provide your car parking space. Okay, there's the risk gone from catching travel. Now I can safely go into work because I believe all the rest of the controls are there. I've got to say it, unless you are having sporting occasions with just friends that you know who's been where, done what, and everything else, there should be some form of health screening done by each club, given to the other club, to know that really simply they've asked every single player a number of questions. Those players have responded to those questions.
Yeah.
The risk assessments are in place, and now we can have our match. I hate to say it, but that's again comes down to control and organisation.
Yeah.
And everybody should be doing it, because you should not be going somewhere that you do not believe is safe. And nobody can force you, whether you're at work or anywhere else, to go into a place that you feel physically is unsafe.
Yeah.
They need to have a grown-up conversation with you and work with you to allow you to understand why it's either not unsafe, or the controls they can put in for your personal circumstance. Cool. That's what I would say. So clubs and football clubs got to do the same. You can't bring another team into a situation that is again uncontrolled and unmanaged, because the more you mingle, the more you interact, the more chance you have of, and it's low at the moment, and we know it's low of the chance of gaining of catching COVID-19 or so. But the more uncontrolled it is, the more chance you've got of having an impact.
It's only low now because everybody's behaving themselves, and well, most people are behaving themselves. But the more freedom we take or allow, and the more contacts we have with other people, then the R is going to go up. So, very aware I've taken an awful lot of your time this morning. Thank you for volunteering for this. It's one of those subjects we could talk about forever. But so to summarise, get it clean, keep it clean, get your management processes right, share those with other people for best practice, and make sure your staff are on board and you've answered any of their questions. Make sure your staff, players, whatever, are on board, and where possible, go to take that extra degree of cleanliness, or take that extra step in.
PPE is an example.
To make sure that you are very compliant and very safe, but it doesn't have to cost a fortune.
No, it's common sense. So I look at the first aid room as an example, right? Something that we haven't touched on. If someone gets injured, you're going to want to help them, right? Have a process in place for the person that's living for. Gone are the days all the players will run over, throw them over the shoulder and put them into the first aid room at the moment, right? That's not, that's the way it should be, but it isn't. So you have designated people that are going to do your first aid. They are wearing full PPE, and they will deal with that situation as best as they can and wait for the emergency services or whatever. So that's, so again, it's just about organising yourself and trying to change the natural habits of the people around you, which is the difficult part. And it's people know that, okay, I'm talking up in rugby, there's a broken bone. Yeah, this person is on standby, they are wearing the correct equipment, they've got everything they need, and they're going to come and administer to that person. You don't huddle around them, you don't do any of this other kind of stuff. So, again, it's just control. It's for the first time, you've got to be, I would say, military planned on everything that you're going to do, and then make sure for once everybody's following those rules.
Yeah.
That doesn't cost money, that costs time. Time slows down revenue into a business. The more time you take to do something, the less you earn from it. And I just hope, with all of the sensible controls in place and everything else, and a bit of common sense and ingenuity, I guess, that local sports clubs understand what they can and can't do, and then been able to start driving some of that revenue back in through their front door. And hey, as I say, if anybody actually wants any advice, they can just drop me an email. It really isn't a problem. We're doing a lot of work to support the FM community at the moment, and I think it's absolutely the right thing to be doing.
Brilliant, thank you. So I'll put your contact details up at the end.
Yeah, you see.
You touched on first aid. Is there anything else we haven't discussed quickly that you think is an important subject?
Well, I think there's if I look at a clubhouse, in my mind, you've got a change room we've discussed. You've got to think about the match officials as well in this. So don't disregard the match officials. They've normally got a very small room somewhere, all three of them or whatever get changed. You've got to find space for them to change safely, or at least inform them of the protocol as well, of them turning up. We very much touched on first aid. First aid is first aid. It should well be controlled, but I think you've got to just what's the word? I think you've just got to plan that to very rigid. Understand who's doing it, when he's doing it, and what the process is. Toilets we've talked around, so I think you've got to just keep them clean. You've got to have a real regular cleaning process. If you've got baby change, yeah, I would leave antibacterial wipes and virus next to the baby change, and I would be putting signs up to say that after you've changed the baby, you should be cleaning it and putting it in the appropriate bin, right? But that needs to be checked. If you've got offices, you've got to follow the office guidelines. Yeah, so if you do have a back office or anything else, get it clean, get it organised. You've got to keep social distancing, and yeah, there's plenty of office guidelines out there to follow, which is quite clear and easy. I think kitchens being another one. If you're going to serve food, you've got to follow those guidelines as well, and that comes back into the whole pub trade, table service, and what you're going to be doing. But food preparation is key. And then on the back of all of this, you're probably going to have a plant room or equipment that's failing and need to have engineers turning up to do fixes and etc. etc. Remember, the guidance tells you that you must manage the entrance and exit of engineers. So when we talked about keeping record of who's coming in and out of site and when and what they're doing, you absolutely have to do that with anybody that you're getting inside to do the grounds, fix your boiler, fix your cooker, whatever it might well be, right? So I think, what's that?
Raymond, for when they're delivering the beer, all those sorts of things.
Absolutely, yeah. And what's the process of beer delivery? Do you keep it outside for a set number of hours and bring it in? There's lots of good guidance out there. The problem with clubhouses is they're multi-layered in what they're doing. So they're not in necessarily one industry. So they've got to really take all of that processes, depending on how diverse their site is, and try and build one for them, because they'll come under a little bit under the gym section, they'll come under the restaurant, they'll come under the pub, they could probably come under the office.
And to be honest, they're all staffed, a lot of them are staffed by volunteers as well. So yeah, it's and that those people can change on a regular basis or at very short notice. So it's imperative that I suppose we keep records.
Yeah, and I wish you all the best. It's going to be difficult to get them planned. I think it's a minefield of planning and organisation, but not impossible. And don't be sold something that costs a fortune and has very little impact. You'll know what's going to have an impact by doing your risk assessment and then putting your what hierarchy of controls you're going to put in place to limit that. And just understand that when it happens, and it will, it's as people move around, there will be hotspots. that come from sporting activities in offices. We've seen it in meat factories at the moment. You know, it is then about, what do you do? You know, so have your emergency procedure in place, have your deep cleaning. I hate to use the word deep cleaning because it's not deep cleaning. It's more virus eradication cleaning. You know, and only, I think one of my other pieces of advice is, you don't know the virus will be in your location, okay? So absolutely the best thing to do is get in there, do a clean of all the surfaces, disinfect them, as I said, with EN approved products and normal household cleaning products that will attack envelope viruses. Clean the whole place, mothball it for a few days, and then you're reopening it safe, unless you are going to do any kind of swab testing and lab testing, which costs you money, which all big businesses should be doing to prove that the area is now uncontaminated. But for me, it's, if you have a case, clean it, mothball it, wait a few days, and the chances are everything's had a chance to take effect and it's naturally died away anyway, and then you're safe to reopen.
Cool.
So don't go and get spray guns out.
And you'll have the records to back up to contact everybody that you need to contact. You may well have been there. Cool.
Yeah. Don't get the spray guns out and spend fortune on cleaning companies. It's not me.
So cool. Thank you very much, Adam.
That's right.
Thank you for coming and talking to us about that. I'll let you get back to going to work. So I'll put links up and then at the end of this for your email and Let's Talk FM if anybody's interested in a bit more FM stuff and around offices and those sorts of bits. And obviously I'll put all the contact details from mine set up and the rugby club itself. But thank you very much. Thanks for watching, and see you all again soon. Thanks, Ed.
Take care. See you later. Bye.